I believe green jackfruit atta is a nutritional gem. I'll start with the first case of my clinical practice. And this is a real world case I'm describing to you. A 58-year-old male patient with type 2 diabetes, hypertension, and dyslipidemia, that is lipid disorders, bad cholesterol high and good cholesterol low. He presented to me 5 months ago with a BMI of 29. At that time, he was weighing 85 kgs. He was on optimal, well-tolerated metformin monotherapy for the previous 12 months on a dose of 1700 milligram per day. He has received appropriate education in diabetes self-management, self-monitoring of blood glucose, that is SMBG, exercise, and meal planning. Hypoglycemia has not been an issue to date, luckily for him. However, SMBG readings have not been at go. And his mild hypertension, he has been additionally hypertensive, and it's well controlled with a quality fixed dose combination of antihypertensive pill. And he has been on atorvastatin 20 milligram daily for control of his lipids. These were prescribed by the previous physician before he saw me, and I agreed totally and just continued that. So when he came to me, I requested for some investigations, and these are the readings. HbA1c 7.8, fasting sugar 127, 2 hour postprandial, that was post-lunch, 207 milligram per deciliter. He had a triglyceride of around 152, fairly well controlled, close to 150 the cutoff, and LDL of 97, again below 100, and HDL at the minimum optimum level of 40 milligram per mils. His liver and renal function were normal, and his cardiogram was normal. So I discussed his reports with him, and after reviewing the available therapeutic choices, normally we do this, use a shared decision-making model where we spread out all the options available in front of our patients and apprise them of the pros and cons of each available agent. And then finally, we mutually decided that he should be additionally on a DPP-4 inhibitor. We selected sitagliptin 100 milligram once a day. This was chosen based on the simplicity of use, tolerability, and the patient's wish to avoid any drug that might cause weight gain or hypoglycemia. And he also quizzed me about a newer class he must have read somewhere, or he must have Googled about SGLT2 inhibitors. And then I told him that this, because he is not circumcised, he can be facing issues of genital urinary tract infection. Then he agreed to not go for that. So 3 months later, HbA1c has come down from 7.8 to 7.4, fasting blood sugar 115 milligram per deciliter. It has also come down from 127 to 115, and 2 hour postprandial sugars have come down from 207 to 187. Not a very impressive correction of postprandial, because DPP-4 inhibitors are known to, that class of oral anti-diabetic agents are known to address postprandial elevations. But in this particular case, we didn't receive very encouraging correction. His lipids were more or less similar, liver function, renal function, and additionally, I had requested him to go for a fundus examination. It was almost 12 months since he had one, and that was normal. So this person with diabetes was reluctant to either increase the dose of existing bunch of medicines he was taking, specifically the anti-diabetic medicines, or add any new one. So he was totally shut to that idea. And at this point, I explained to him the benefits of replacing 15 gram of his rice batter or wheat atta intake twice per day by raw or green jackfruit atta, which is available online. He agreed to my suggestion and I requested him to share his SMBG readings periodically, 10 days after regular, twice daily start of green jackfruit atta usage. So this is the snapshot of those readings, some of those readings. And he was kind enough to take the trouble of pursue his post-breakfast, post-lunch, and post-dinner sugar levels on various days, as I had explained to him. So if you look at the day 11 after starting of green jackfruit atta, he had at that point His sugars came down from 115 to 110 fasting. His post-breakfast sugar was 175. Then he had shared all fasting sugar levels. If you compare on day 11 to day 45, significant statistical decrease. Of course, I have not calculated the p-values, which is the benchmark of knowing the real efficacy of intervention, but this is the real world data. So I was happy with the numerical reduction. And 2 hour post-breakfast done twice during, captured on this slide, from 175 on day 30, it came down to 144. And 2 hour post-lunch sugar from day 18, if you compare it to day 45, significant reduction. And 2 hour post-dinner. So because we had covered his breakfast and dinner with that 15 gram of green jackfruit atta, and I think it showed some impressive results, as all of you would agree. So on day 45, fasting blood sugar of 110 on day 11 came down to 92, and the postprandial sugars post-lunch, which was around 187 before he started his green jackfruit atta use, it came down to 142. So as can be seen, optimization of blood sugar levels was achieved within 6 weeks of regular use of green jackfruit atta in this patient. He has also lost 2 kg weight in the meanwhile, which is very reassuring. And his most recent, so this was done slightly, because I was keen on knowing what was happening to his HbA1c also. So this was done last week, where he has entered the 6th month of his follow-up with me. So the LDL, HDL, and triglycerides had an impressive, lowering from 152 to 137. And HbA1c came down from 7.4 to 7.2. That is also, let me tell you and remind all the August audience, whoever has joined us, that even a small drop in HbA1c percentage translates into major benefits in terms of decrease in at least microvascular diabetes related complications.